Anyone who has tried to find a family doctor in this country knows what a challenge that can be. Universal health care, sadly, doesn't mean everyone gets their own GP. The NDP has promised to change that, promised to help every Canadian find a doctor. Laura Stone does a reality check on whether they or anyone can deliver on that.
Dr. Angela Varon could have worked anywhere, but she chose Renfrew, Ontario, close to where she grew up, because the town offered her a $150,000 bonus to come home.
It showed that the community had a great support for physicians and that I would be appreciated here if I did come.
That money didn't come from the government. It was raised by businesses and community members, an incentive to draw more than a dozen doctors back to a rural community struggling to find physicians. But those who helped raise the money say it's not sustainable.
Taxpayers are not cash cows where you just take money and not put services back in, and that unfortunately happens way too often in rural Ontario.
Now, the NDP is promising $500 million to help every Canadian find a doctor.
We'll help up to 5 million more Canadians gain access to a family doctor and community health services.
The party says it will build or expand 200 clinics across Canada and pledges tens of millions for recruitment grants like the ones in Renfrew.
I think it's safe to say that it's one piece of the puzzle. We definitely need more family physicians.
But the number of doctors is increasing. A new report released today shows there are almost 80,000 in Canada, but they're not always going where they're needed most.
Where the issues will remain will be around distribution of physicians and distribution of other healthcare providers.
The Conservatives say they're already tackling the problem by trying to lure doctors to rural communities.
Student loan forgiveness for doctors and nurses, like we've done to incent them into the rural and remote areas, is one really great way to do it, or actually fund residency positions in rural and remote areas.
The Liberals promised to talk health funding with the provinces, but haven't gotten into specifics. And doctors like Varon wonder whether any party can afford to find every Canadian a family physician.
I don't know how the government's going to come up with the money. There's going to be cuts somewhere else, and that's going to cause other problems.
Yeah. And pain control. Laura Stone, Global News, Ottawa.